college nursing student. Can I get your name and date of birth?
Denise Browder, 1674.
Okay, I'm just going to double check.
Okay.
Are there any allergies that I need to be made aware of?
No, no allergies.
Okay. So today I'm just going to be performing your head and neck assessment. We're just going to be going over making sure everything looks all right, okay?
Okay.
My client is in a safe and comfortable position. So let's go ahead and get started. Do you know where you're at?
Kilgore College.
Okay, and do you know what brought you in today?
Head and neck assessment.
And do you know who our current president is?
Trump.
And do you know what month it is?
February.
Okay. Do you know what you had for dinner?
Steak and broccoli.
Okay, and is that a common diet for you?
Uh-huh.
So I'm going to be starting with your vital signs, okay?
Okay.
Can I get your height
5'4".
and your weight?
195.
Okay, and I'm going to be using a numeric pain scale today, 0 being no pain, 10 being the worst pain you've ever felt. Are you experiencing any pain today?
No pain.
No pain. Okay. So we're just going to be taking some vital signs. I'm going to start with your temperature, okay?
Okay.
Have you had anything to eat, drink, hot, cold, or tobacco products in the last 30 minutes?
No.
Okay. So this is just going to go under your tongue, and you just close your lips on it, okay? Okay. Cleaning it. So your temperature read 98.7. Now I'm just going to be taking your blood pressure, okay?
Okay.
I'm going to clean my supplies. My client is in a good position. This is just going to go over your arm, 1 inch above your brachial artery. And you're just going to feel a tight squeeze and release, okay?
Okay.
Do you know what your blood pressure usually reads?
About 120 on the top.
Okay.
Okay.
Heart rate, I got 85. Respirations, I got 17. Now I'm just going to take your O2. This just goes on your finger, okay? I got 99. Now we're going to be moving on to your assessment, okay?
Okay.
We're going to start with your head. I'm going to do some hand hygiene and grab some gloves. So for this, I'm just checking for skin color, any bumps, making sure your hair is evenly distributed. Okay. Put my gloves away, hand hygiene. So now I'm going to be filling your sinuses, okay?
Okay.
looking for any swelling, okay? So just let me know if there's any pain. Okay. I'm going to be checking your eyes now, okay?
Okay.
So I just want you to look at the black object on the wall and tell me whenever you can't see my pen anymore.
Now.
Okay. And now I'm going to do the other side.
No.
Okay. And now I want you to follow my pen light with your eyes only, not your head, okay? Okay. Now I'm going to be checking your pupils, okay? So this is just going to be a bright light in your eyes, and you're just going to look at my nose, okay? Okay. Other eye. Okay. And now I just want you to follow my pen light, okay? Okay. Now if you could just grab under your eyes, look up. Perfect. Alright. Now I'm going to be moving on to your ears, okay?
Okay.
So I'm just looking for anything red, irritated, some lacerations, okay? Same thing to this ear. Alright, now I'm going to be doing a whisper test, okay?
Okay.
So just cover this ear,
Okay.
and I'm going to say 3 things, you just repeat, okay?
Okay.
Bear, slow.
Bear, blue, slow.
Okay, and now the other ear. Dog, red, fast.
Dog, red, fast.
Okay. Alright. Can I have you smile, frown, and puff out your cheeks? Perfect. Alright, now I'm going to be moving on to your nose, okay? So can you just hold one nostril, breathe in, other nostril, breathe in. Alright, now look up. I'm just going to check in, make sure everything looks okay. Alright. And now can I have you look up, stick out your tongue, and say, ah. Perfect. Okay. Now I'm going to be checking your range of motion on your neck. So can you turn side to side, up, down, all around, and let me know if you have any pain?
Nope.
Okay. Now I'm just going to be feeling along your lymph nodes. I'm just checking for any swelling, okay? Palpating. I'm going to have you turn to the side. I'm just going to check your JVD and feel for your carotid artery. Okay. Now the other side, I'm feeling for your JVD and your carotid artery. Okay. And now we're going to be doing a resistance test, okay?
Okay.
So I'm just going to be putting a little bit of weight on your shoulders, and I want you to push up, okay?
Okay.
Perfect. Okay, so now I'm going to be placing my client in a comfortable position. Call light in hand. Do you need anything?
No, I'm good.
Okay, so I'm going to be performing some hand hygiene, documenting, and I'm going to go read this off to the provider. Okay, so my client has symmetrical facial features. Her hygiene and diet, they were good. There was nothing to be noted. She was alert and oriented ×4. Her skin color was even and appropriate. Her speech was good. There was no slurring or anything to be noted. Her hearing was good. She was able to respond accordingly. Her vitals were good. There was nothing. They were all within range. Her heart rate was +2 and her respiratory rate was unlabored. Her head was good. There was nothing to be noted. Everything was, her hair was evenly distributed and there was no lacerations. Her sinuses, there was no swelling or no abnormalities. Her eyes were 3 millimeters. Her pupils were equal, round, and reactive to light and accommodations. Her color was good and the structure was good. Nothing to be noted, and they were symmetrical. Her ears, there was no drainage, no lacerations, no redness, and her whisper test was ×3. Her nose was moist and the nares were good bilaterally. No lacerations or anything to be noted. Her mouth was good. It was pink, moist, and her tongue didn't have any sores or blisters or anything around her mouth. Her neck range of motion was good. Her lymph nodes were not swollen, and she reported no pain when checking her range of motion. And her shoulders were good with the resistance test, and her mood was calm and relaxed.